That's the bus you got on?
No, that's not the bus we got on. There was so many bachelor parties. Yeah.
In Austin?
Yeah, all his friends are from all over. So this is where they, I guess Austin's one of the places to have your bachelor party. I had no idea.
No, it's not. Vegas is the place.
I know. I guess, like,
No friends are saying, let's go to Austin.
Hey, let's go to Austin.
hey, we had the bachelorette party and bachelor party.
Even if you live in Austin.
There was no less than like 10, unless they were all lying, I have no idea. But there was one dude in their group that was like 6'10", and he
It's like
was,
assumed.
they all went to USC, and he was the center on the football basketball team. I do believe that. That dude was tall as shit. But anyway, he said, yeah, I broke up with my fiance for about 5 months, and then I proceeded to fuck every nurse and PA in the whole hospital. He probably did.
Okay.
Yeah. And you should see him. He's like 5'3", not even remotely cute. So I'm like, I don't believe that.
Oh yeah.
I mean, not even cute.
I thought you said the 6'10" guy.
So then I decided maybe I want to be a family man, but promise you, every PA I have is going to be fat as shit.
All right, hi, everyone. It's Dr. Buford. I'm here at the Rest of the Shoulder Gym. We're just getting started on your left shoulder. We're looking in from the back to the front. It's a little hard to see because there's torn rotator cuffs in our face here. We will slip around the back of the biceps and trim out some of the torn rotator cuff tissue so we can see a little bit better. We're going to have to figure that out there. Okay, so here's the biceps tendon. We're going to pass a stitch through it because you can see here it's torn. We're going to go off in the video and get a clearer picture for you. Pause, please. Okay, we're looking down the front. I don't see any significant problems down the front, and luckily the articular surfaces aren't in that bad a shape. You can see the ball up above is pretty smooth and the socket down below. Hold the camera. Rotate around to 12 o'clock again. Focus. The biceps is torn. We tried to put a stitch in it, but it was already torn, so we just completed the tenotomy, took care of the stump. We'll look down here, and then we'll look towards the back of the shoulder, all the way back here. We've got some tearing here. We're going to put the scope in the front so we can get at that. Pause, please. Okay, here we're looking from the front to the back. We're looking up at this big tear in the rotator cuff. The hole's at the top of the screen and a little bit off to the left. We're looking from the front towards the back. And our shaver is right at the insertion side of the cuff where it's pulled away from the bone. So we've got our work cut out for us. We're going to clean up a little bit here from this angle, and then we're going to go above and get to work fixing this for you. So we'll go off on the video. The next thing we show you will probably be up in the subacromial space, and we'll talk to you a bit more there, possibly. So here's the big tear in the rotator cuff. This is posterior. We can see how it's split. Let's see what's going on here. Oh, look at that. This is actually just a little piece of it here. We lift this up. See underneath there. So what we're going to do in these situations, what we'd like to do, is see about placing a stitch or two across the tear. Something like this for starters. Okay, so we're going to load a suture into that black wire. That black wire is called a super shuttle or a shuttle relay, just in case you hear us call it that on the video, you'll know what we're talking about. That black wire doesn't stay. We use that to bring suture across the tendon. So now you can see there's a white suture going across the tendon. And then here posterior side of the tear, which is the right side of the screen. We do this maneuver just to make sure there's no twist in our suture. And now we're going to tie a nice sliding knot, which you'll see come down on the screen here from the right side. Get this done and show you some more in a minute. Cast another stitch, another what we call side-to-side stitch. And we're going to tie this just like we tied the white suture before. We'll slide down the knot pusher and show you that. There's the knot pusher in the back. And we'll take that tool that we call a pincher tool and make sure that there's no twist by looping around this suture. See here is a guide that we use to place our anchor into the bone. And then we just hammer that anchor down into the bone, and it's going to give us some more sutures to work with. We'll show you some more in just a minute. Okay, here you can see the sutures. There's actually 3 sutures from this one anchor, and now we'll just spread them apart so we can decide which ones we're going to work with first. I'll get some of the cup out of the way. I'm going to start with the black and white, I think. Take this suture right here like that, and then we'll take a straight crescent suture hook coming in from the right side of the screen here. And we're going to try and make sure we get very deep layers of this tendon that's torn. Okay, we've got 2 out of the 3 sutures from the first anchor tie. I just want to show you back here what we're doing. So we've got, look to the right, there's one suture, there's the black and white striped one, and here's the blue and white. So we've sutured down or anchored down this posterior part. We're now going to go ahead and do the next one a little bit more anterior to the front right about here. So I just want to show you the progress we're making. We're going to take out one of the blue and white suture strands just like that. And then we'll take our turn to the left hook. So you can see it here. This tear is big enough that we're going to need a second anchor. So we're going to do a total of about 6 sutures just coming from anchors here. We're going to place this one down here. Just about there. Okay, pause please. Okay, we're all done here. We've placed 3 triple loaded anchors. That's 9 sutures plus 2 or 3 side to sides. 2 side to sides. That's 11 sutures holding this down, and we've got it down snugly repaired. But you can see it was delaminated. We've had to try and get all the layers repaired as best we can and holding it down to the bone there. So we're going to finish up here and get you back to the recovery room shortly. Good luck to you now. Bye-bye.